mini symposium session, Menopause and Age-Related Issues. I am truly grateful for your participation. As we gather to engage in meaningful discussion and exchange ideas, I encourage you to take this opportunity to connect, collaborate, and inspire one another. Together, we can make a significant impact. Thank you for joining us, and I look forward to an enlightening and productive session ahead. Now I would like to invite Professor Anuji Gamage, our session moderator, to the panel. Professor Anuji Gamage is a professor of public health at General Sir John Kothawala Defence University and a visiting lecturer at the Postgraduate Institute of Medicine at the University of Colombo, with a strong background as a community medicine specialist and primary care physician. Professor Anuji Gamage, the session is over to you.
Thank you, Damayanti. Okay, so today I welcome you all to this session on menopause and aging. Let me invite Dr. Darshana Abegunawardana and Dr. Shiromali Disanayaka and Miss Edna Mokaya to the stage. And let me introduce Dr. Darshana Abegunawardana. Dr. Darshana Abegunawardana is a prominent obstetrician and gynecologist serving as an honorary senior lecturer at the University of Sri Jawadanapura, Secretary of the Menopause Society of Sri Lanka. He is involved with the South Asian Federation of Obstetricians and Gynecologists and the Sexual and Reproductive Health Committee of the Asia and Oceania Federation of Obstetrics and Gynecology. Dr. Shiromali Disanayaka is a committed community medicine professional specializing in maternal and child health. She serves as the Social Secretary of the Menopause Society of Sri Lanka. She is a member of the National Resource Pool for Gender-Based Violence and acts as a resource person for the National Elderly Child Care Development Program and Adolescent Health. Dr. Disanayaka also contributes to the National Non-Communicable Disease Program. Ms. Edna Mokaya is an experienced professional specializing in sexual and reproductive health. She holds a Master's of Public Health in SRH, a bachelor's degree in Food, Nutrition and Diabetes, currently serving as the SRH Technical Advisor at the International Planned Parenthood Federation Humanitarian Division. Edna has extensive experience in the humanitarian sector focusing on SRH and emergencies. I welcome you all to this discussion. So this is how we are planning to do it. We will pose one question per speaker in the first round, and there will be 3 rounds, and they will discuss about current and these current topics. So let me pose this first question to Dr. Darshana Abegunawardana. He will be given 5 minutes to discuss on this topic. So the first question we have, Dr. Darshana, is what are the common menopause related issues among Sri Lankan women?
To initiate with the discussion, I think we need to know the woman, who is the woman we are referring to. The woman at midlife, I think, having dedicated her life over decades to her own family and the society and for the development of the country. And now she is passing through a very transitional phase in her life, and so still she's contributing to the development of the society in the country and looking into her contribution. So when we go through the statistics, and we know the female workforce is, according to the statistics on 2023, and the female workforce is somewhere around 32%. But actually this is not the figure we should refer to. Actually the majority of women actual contribution or their dedication and to unpaid domestic and the care work, actually we didn't calculate this one to that figure. And at the same time, so even the older women, they remain very active in their extended families. They do take care of their grandchildren as a caretaker, actually. And this is another one aspect. And the other aspect is, say like when they come to this age, many women are in very key positions in the hierarchy. Maybe in the private sector or in the government sector, they hold very higher positions. And they contribute still, then this is very vital. Their decision making and their service management is very vital for the development of the country. And then the question is whether we are giving something back to them to meet their demands. So unfortunately, we have very limited number of research in this field, in Sri Lankan context. If I consider a recent, I think that was done, there's a cross-sectional study was done in Sri Lanka, and about 680 women was participated, and there it shows the prevalence. And I think prevalence of the more than 90% had one or few menopausal symptoms. But the thing is, the most prevalent menopausal symptoms was the joint and muscle discomfort, and then it roughly counted for 75%. And physical and mental exhaustion was seen in somewhere around 55%, but actually hot flushes were seen only in 40%. That may totally, be different when we compare some studies in UK and the European society, and that will basically counted for more than 80-85%. I don't know, difference maybe because we are in a country in the equatorial region, so then we are very used to this hot weather, and the woman will perceive this as a normal thing in their life, and because they were used to. Maybe even the cultural differences and even the dietary habits. All in all, so this is the situation in the country. That we as a menopause society, we had a recent study to understand the health issues in this population, and that was conducted a year back. So then during this study, we realized, and when we start the study, actually so 65% of women had one or more non-communicable diseases. And then at the end of the study, so we realized dyslipidemia was found in 71% of the population. That's so huge. About 68 to 69% had hypertension, and the diabetes in 30%. So when we consider the osteoporosis, major osteoporosis risk and the hip fracture risk, somewhere around 26%. And metabolic syndrome risk was 65% again. So then if you realize these findings, figures, then you can understand the implications, health implications, what is going to happen in the future. So there will be a very big impact. Same time, so then even this population is going to face it so many problems. I think to address these issues, there are so many barriers and the restrictions in Sri Lankan context. And the main one is, I think, the awareness, poor awareness. They are not aware of these menopausal symptoms because either maybe they are not aware of these symptoms, or maybe negative attitude, or even socio-behavioral problems, restrictions, or stigma behind these. So, but when we compare a woman in European country and in Sri Lanka, it's totally different. So what happened, women in UK, if they perceive a menopausal symptoms, they will quickly go to a doctor. They want to take immediate advice. But unfortunately, in developing country situation is totally different. They don't want to perceive, and they don't need to go to a doctor and have a treatment or have advice. So then if they go, they can prevent most of the preventable complications at the very beginning. But unfortunately, this is not happening. And the other thing is a social stigma. Maybe some are reluctant to say that they are menopause, and some are not. And the other thing is the negative attitudes. And the other thing is sometimes they don't want to go for medical advice. Maybe due to economic crisis, they may have some restrictions. And then as a government is not in a position to provide hormones, very freely. So they can't, out of the pocket expenditure is very high, so then for this HRT, and they don't want to go for. These are some issues. And then the other thing is the access to healthcare facilities. When we consider it being in Colombo, that everybody will say, no, you have a very big access. But if you go to a periphery, that will be the other way. And so it's not equally distributed. And the other thing is we don't have support groups. And if we have a support groups, I think, that they can share their experiences and advices. But unfortunately, we are not in a position to have such groups. I think these are the problems related to menopause in our country.
Thank you, Dr. Vegunawardana. You very insightful actually. True, our people, our women who are facing these issues, they are reluctant to talk about these, and the partners' involvement in these issues. And also, but I was wondering, now we have healthy life centers, so we screen for NCDs, but still these are very much underutilized. In the community, these are underutilized services. So we'll come back to you to discuss about these things. Moving to Dr. Disanayaka, so we would like to know what are the social impact and societal response to menopause and age-related issues.
Thank you. Actually, the menopause is a biological phenomenon which all the female are facing in one day. We have to address on this, and I think Darshan have told a lot of things about the negative aspect of that. But we have to the menopause and the physiological event we have to manage properly. If not, there'll be a big problems coming, especially for the person, and again after that to the close family members also. The one thing is actually menopause is in Sri Lanka, the knowledge dissemination is very less, and there's no grassroots level proper program is going on like other programs. I will discuss in my next question. And because of that, the female who is going to have menopause is mostly doesn't know anything about menopause and what are the signs and symptoms of menopause and what are the outcomes and how she's going to overcome these issues. Are there any prior things that she can do to minimize the effects on that? So those are the big problems with our society at the moment. So if she knows all these things, she's prepared for these, and then she's ready for the menopause, and that will be the very happy life of her. Actually, the last third of her life, she'll be very happy. But the problem is, since she doesn't know anything about it, her family members doesn't know anything about it, so there'll be a big problem. For example, as Darshana said, aches and pains are the main problem in our country, but no one knows that is due to menopause. When you organize some kind of a medical program, the most of the female are coming with aches and pains, and the other complaint is they can't work now as earlier. They are not active. So those are the things, and we also frustrated because we are always writing the drugs for the aches and pains, nothing else. So, but behind this is menopause. So we have to know about it. And the other one, for example, another one is the hot flushes, I'd say the third cause. What will happen when she feels those things, like everything, she's embarrassing, and she can't work properly as earlier, and these issues will help make the problem for the others also. For example, very rainy cool night, she is going to switch on the fan and the AC, and the partner have to tolerate these things. So sometimes what will happen, if he doesn't know anything about this, so there will be small arguments going on. Every day she is facing this problem, and her husband also facing this problem. So without understanding this issue, there will be a big problem with the time. So they don't cooperate every day, the same thing. What will happen next day? And the whole night both of them were awake. And next day, how can they work? As a mother, as a wife, she have big role to do it at her home. So if she can't do this work, so the family member, husband and the immediate family members, children are affected. What will happen? The next day morning, the children miss their school buses. They go to the work very late. So there are so many things happening because the mother is the wife is the key role at home. Imagine how, if she's working, so she have to do her work at home and then she rush to her workplace. What will happen? The single one symptoms is make everything very bad. When she can't work at workplace also efficiently like other days. So, and she will be blacklisted and she will be scolded at workplace, and the team also scolding because the outcome is a team effect. So if she is not working, sometimes the others also can't do their work. So finally the outcome is very bad, and the economy, the workplace, there are so many problems. So every day, if she is not treating, if she is not identify this problem and get it treated, finally she will be chased out from the workplace. So what will happen to the economy of her family life? So this is a vicious cycle going on and again and again. Even in the working place also, if that environment is not suited for her, this problem is going again and again. So there will be big problem. Finally, these outcomes come to the country also. So country also economically in two ways. It's because the productivity is going down, because at the moment 60% of the females are in this age group 40 to 60 years. So the big amount is there. Workforce is very much higher in this age group. So because of that, the outcome is also getting low. And the other hand, if you are not identifying these issues, I mean osteoporosis and things, also then you get the fractures and NCD also. There are so many comorbidities and all these things. If you not identify, then the health seeking is very high, and the health expenditures also getting higher and higher. So we can identify these things very early and do. There are so many things to do. Mainly the awareness itself can do a lot of things. If you can do some intervention in the early stage of menopause, there will be a big outcome as well.
Okay, Dr. Lanka, thank you very much. The key words you highlighted were awareness, lack of awareness, health education, cost of no action, and also chain reactions due to these things, and also ultimately ending up in the economy. So yes, definitely this would have a repercussion on the economy. Yes, you are very correct. So moving on to our next speaker, Ms. Mukaya. So she will be talking on the psychosocial impact of menopause on women.
Yeah, thank you. I'm looking at how this woman is interacting with herself, and also how she's interacting with the environment, that including the people she's living with, where she's living, the economical activities that she's doing. This is a woman who was surprised, first of all, with her menses as an adolescent. She caught up with it, adjusted to that, maybe went through childbirth, and bought the narrative of life starts at 40. And she's settled. She's thinking, now I'm going to have fun. The stresses of children crying around me and all that are gone. And then she's caught up with another surprise. This body you had thought that you had controlled, you can no longer control it. Why? Because you're having those erratic symptoms. There is no order. There is no formula for it. The way I will react to it is different from how the doctor will react to it. Today, I might wake up with a mood swing. Tomorrow, I am happy. Lunchtime, I am so hungry. I am eating. I am able to go downstairs 3 times a day today. But in the evening, I feel I cannot lift this leg because I have a knee pain. I cannot lift my arm to get my best dress to go for dinner because I have a frozen shoulder. I don't understand what is happening to my body. Life has changed. First, I am not aware on what it is that is happening to my body. Who do I talk to? What that gives me, I isolate myself and think, I have sold the narrative that I was this go get it all woman. I am the conqueror. And now I cannot even manage my own body. I keep to myself because I was not prepared. I was not equipped to identify that. I don't know. I just think like, whatever is happening, it's something happening. I don't know. I might be sent into self-judging myself and now examining myself and thinking, what did I do wrong? Did I eat wrong foods? Is it because I partied so many times? Do I have a disease that the doctors are not finding? Miserable on misery. Then you don't even know how, you don't have the patience as a woman. Your friends might notice that you have a problem. Some might not notice. The ones who notice will call you and ask what is the problem that bothers you. Why are they poking their business into my business when I don't even know what my business is? And those who are not asking because they don't know, I'm angered inside because I feel they have ignored me. That affects my relationships. And I look at work physically. I am weak. Most common, I have a brain fog. I have written things. I have been given assignment by my boss. As soon as I get out of that door, I can't even remember what I was told. And I can't even find, just a simple thing like unlocking the door because I have a password. I have a thought block. I am frustrated and wondering what is happening. This is menopause. This is something that is happening to me. So I need to calm down. I do not know how to give myself those remedies. That affects my performance at work. And that when you look at work at this point, because menopause 30, this is when most of us are managerial plus. We have ticked the boxes from junior interns, junior officers and all that. So we have this responsibility. But our brain function is this small. Nobody understands. We don't also even understand. We get frustrated. We will be taking more sick offs. It's either you will be named as you're abusing the office or she's gone crazy. Remember before, you were the smartest. You didn't require assist. You led people, you advised people, you gave solutions. Now you are asked a question, then your own brain shames you and decides, no, this one we are not answering, and you can't. So those are things, they affect your work. You are expected to be there, but you can't. Affects your performance, might affect your pay or being retained in work, and might even affect how you relate with your co-workers and even the effort to that work because you don't have the energy. And you look at this at times, at this point, menopause, most of the women are managing their old parents. So there is that burden that comes with in Africa we call it the African tax. Yeah. Like, so you have to pay back to your relatives, to anyone else who is dependent on you. Most of the time you find your parents are sick, they need support, they are in hospitals, they are, already in that social pressure you cannot handle. You might not even have those resources. Remember yesterday you took a sick off because you are sick. Today your mother is sick, she needs you. Tomorrow your father is sick because they are old and they need you to see them constantly. So it also puts that, strain on you. You might also, at this point, your children are assuming mom is experienced in all this. And they are calling you, Mommy, this boy I loved has broken my heart. And you're feeling, no, that is something you can solve. And your brain cannot understand, why is this child stressing me? Point. You don't know how to be supportive. You become irritable. You might push your children away, or your children will just distance themselves and say, she's gone bananas. If you are in a society that doesn't really have the patience, such women are condemned and put in facilities because the society or the environment around them is not supportive. So when you look at even in the health system, in the healthcare system, as they have correctly said, most women, studies have shown that they go to health facilities to try to find answers because they really don't know what is happening. Today she went for an headache. Tomorrow she's gone because she's having the pain. When she was walking out of the house, she had a pain, or she's starting to forget too much. By the time she reaches the facility, the symptoms have changed. And what has the healthcare provider tell you? No, you're not, you're not sick. You have psychosomatic issues. You're imagining sickness, because the health system also is not well prepared to identify that. Because remember, menopause takes quite a long time. You don't have to have gray hair for you to have to start menopause. It starts early. In summary, menopause affects women a lot because we know of the estrogen drop, and all our cells all over the body, we know we have so many estrogen receptors. And when they are there hoping to get something and they don't get, the cells themselves get frustrated and try to fix themselves, trying to reach out to a hormone that they cannot reach. And that's why we find this affecting us physically, physiologically, and then it affects our social life and everyone around us. Thank you.
Thank you. Thank you so much. You are very right, isn't it? So in this context where women are considered as to be whiny and nagging, could be hormonal, right? Just that understanding women might need. Yeah. So from moving from the problems to solutions, so what initiatives have the government, Sri Lankan government, taken to mitigate menopause-related issues? Do we have such things?
Very less to talk on. This regarding actually, I think government is trying, but anyway, they don't know what to do, I feel. And because most of the resources are going to be wasted. Actually, so we as a menopause society, we suggested menopause task force. So what our intention was to, make a team spirit, and, they can take decisions and they make policies, and then they can create a favorable environment for these women in the country. But it was initially agreed upon, but anyway, so unfortunately it was not implemented. And the second one, we as the menopause society, we wanted to start dedicated midlife clinic. Actually, we made even the health record is also finalized, and we wanted to initially start this as a pilot project in 5 hospitals like Ragama, Kasal, Kalubovila, Kalutara, and Homagama. But so all in all, but we couldn't still start yet. But we did some programs. We wanted to educate the stakeholders and the medical professionals who are involved in these clinics. And then we conducted one clinic at Kasal. And what I can say, say only clinic which I know is the Well Woman Clinic. That was initiated in 1996, and I think there are about 1,000 centers island wide. And but unfortunately, the target group is 35 to 45. So we really suggested to increase it to 60, but unfortunately, anyway, so they are going to say yes, but anyway, they're still not implemented. And they do in these clinics, they do some screening for NCDs and then some common cancers. There was a recent development. I think they wanted to include menopause rating scale into these health records, but I think it's a good initiative at least. And so Well Woman Clinic, so we can make use of it, but anyway, so we need to modify it in my personal view. And the other one is I think currently we don't have much, but there are some programs run by Menopause Society. It's not because I'm representing the Menopause Society, but actually we do a lot, and we have very good feedback, and we are in that ground, so we know awareness is the main problem. So awareness wise, it may not be the stakeholders or a medical professional. We have to make aware of this public. So we do conduct courses for the pub separately. We do conduct courses for the health staff separately. And I think more than I think many number of programs have already been done, and there's a very good feedback this, because so we can on an open discussion about this topic can change the stigma behind this topic. Then everybody is free to talk on that, and otherwise what happened, they are going to be scared, and then here even the partners are going to be in these meetings, and then partner is going to have some sort of awareness. Okay, this is a normal thing. I mean, we need to the help by our partner. Something like these programs are very helpful. And other thing is, I think other than those things, there's no any initiation by the government. Yeah.
Okay, it's very important, the partners' involvement and getting them on board to help women who are going through this phase. Since we have concluded talking about the services we have for menopausal women, do we have, how have the government addressed age-related issues at society level in Sri Lanka?
Actually, the government in health ministry, there's a directorate for the elderly care, youth, elderly and the disabled. So there are programs going on, but they are mostly about administratively, such as development of national policies and the preparing of guidelines and circulars for maintain the curative and the care centers and health grass health level to streamline the programs going on. And there are some programs they are preparing for some curriculum revision curriculum for the postgraduate educational things for the undergraduates and the postgraduate medical officer medical career, as well as the primary health care staff and the hospital staff. Those are the things mainly they are doing, and some they are also conducting some national steering committee and some technical advisory committee. Those things are there maintained by the directorate, and there are some communication with the partnership with the NCD also now, because there's another directorate for the non-communicable diseases, so they have hand in hand, they do some work. Those are the things normally having. Actually, have to say, not like the other programs like child welfare and maternal care, there's no uniform disseminated program is going on for the elders. At the moment, there is one program is going, there's no program for the community-based level. Most of things, but at the moment, there's a JICA projects going on, started on 2022 and start going till next year. That program, of course, very good, and it's very that's in the grassroots level. In the community-based program, they have selected 4 areas, 2 areas in Colombo, Paducah and some other place where it's in Horan or something, and the other one is 2 areas in Badul, and those areas they do lot of work. They have a center for the elders, and they are get them to the center it's like a daycare center who comes in the morning and they spend their life whole day at that place, and they share their work and their ideas and things, and they sometimes there are some programs going on for to earn some money for them also. For example, they make some handicraft, some are making some bags, paper bags. So like that, they are helping the people to do some work, and with the AGA office staff, they try to get some money. They have some form of platform to sell those things and get some incentive for the elders. So that's a good program is going on. That program is ending on next year, but it's still a pilot project. I hope that will, with the results of that, they can disseminate for the country. Other than that, there's no community-based programs going on for the elders. So those are the problems with the elders at the moment. So we think we have to do something. We have to prepare good work with the help of, the ministry have to disseminate those things and get it arranged. But the problem is, and there's another directorate for the non-communicable disease, HLC program that is based on all the base hospitals and some rural hospitals also and districts also. That is, there's a monitoring is there, the daily, they evaluate everything annually. So their program is going on. But the problem, the female participation, it's good. Fairly good, but the male participation is very less. So today also I discussed with directorate where they said that is the problem, how to get this male. So I asked whether when you are next year, when you are finishing this community-based program, are you going to disseminate it? Problem is how to get the male. If you can give a bottle of arak, they definitely will come. So that's the problem. How to get the males? It's a one problem. And the other thing is, though the females come to the NCD clinics, the HLC clinics, you can't cover everything. There's certain things have covered. Some, for the example, they do cervical cancers. They screen the basic screen for the breast and cervical cancers, and then they screen for the diabetes, hypertension, and ischemic heart disease and the obesity. Those are the only things can do there. So there are so many things you have to see. The dementia, as she said, there are so many repercussions coming with the dementia in future. Still now also we have so many issues with the dementia, the person itself and the family members also suffering with that. So there's a big issue is there. The osteoporosis is another big problem. So those things are not screening, but there are so many things to be screened, and the mental health. There are so many issues with the psychological issues. So those things have not addressed yet in those clinics also. So we have to do some, especially if we can, for the females, we can some these middle life clinics in the hospitals. Then we can do something because it's a multiscleral thing, and if you can refer there, and then normally we plan to do it on base hospital upwards. So there are consultants for the different disabilities. So we can refer them from there. We can do the screening, and then if we can refer them to the specialized place according to that. So I think start these things very soon, because that's a big problem in future. The elderly population going up and up. And the other thing, the one thing I tell is, those days, as I think Darshan started, our grandmother and grandfather is looking, that's by the grandchildren and children. But the problem is now they are alone. They are alone at home. Their children is not there. They are away. Most of them are in abroad now. All young people are going up. So we have to see how we are going to look after these aged people. So we have to have a good plan and do something very quickly.
Okay, thank you for that very extensive answer. I agree with you. In Sri Lanka, we are a model to the world because we deliver our MCH, maternal and child health services. We are actually a model to the world. Youth, elderly, yes, we are trying to implement grassroots level work, grassroots level services. And also the other problem is, you very rightly pointed out, we in Sri Lanka, we thought we were taking care of our women because women have so many points of contacts with health services, unlike for men. And the main reason is, you are right, because yes, very difficult to get men and their daily pay. So there the earners, they don't want to lose a day's work to come to the clinic. So that is why HSCs are very much underutilized. You are very right in pointing out these facts. And moving on to our third speaker, you have a very lengthy section. And what policies and programs have governments implemented to address these issues?
Thank you. I will break it into two. First, as I menopause, it's not a one blanket all. People get different responses, or they feel different from the other person, and something also affects them differently. Symptoms appear differently, and the impact those symptoms have on them also differ according either at an individual composition as a human being, their health status, their support system, and their social cycles, and also their economic muscle, and again their educational level. How exposed are they? This is not just the school books and all that. It's health education. Are they aware of it? Are they efficient enough in themselves to manage these symptoms because they are able to see them and then address them? Because again, you see, menopause is a process. It is a natural process that we all have to go through. How you go through it depends on if you have those factors that I have mentioned. So when I look at the issues on a global context, there are other things that also affect. Look at the culture of this person, where they are coming from, the socialization. Some communities do not talk about menopause. The simple question I have, how many here in Sri Lanka, I don't know, but I would ask, do you have a name for menopause in your local language? Do we have that? Do you have a name for menopause? Not the English. Maybe you would tell me, I don't know. So when you look at the fact from where I've come from, we don't have that. But what it is, what that comes with, it's you as a woman being condemned that you are old. So because you are old, you will have more problems, and you should accept those problems because you are old. And then you see some cultural practices put limitations on old people. So an old person cannot do certain things. This is someone who is expected to exercise, but because you are old, you can't do a lot of work. You can't do this because you are old. Other cultures limit you from eating certain foods because you are an old woman. And maybe those nutrients are the ones that would have helped you to make the symptoms mild. And there's nothing you can do about it. And because of the shame that comes with this menopause, because first, we are not accepting it as a physiological process, but instead, what are we looking at it? Oh, you are old. So when it comes to reproductive health, sexual and reproductive health, X for you. But this is not about them being old sexually. It is just the conclusion of the reproductive process. But their sexual health still continues. The sexual life should continue, but you have been condemned. So what do? You zip up and you do the self-blame, self-stigmatization. So you have those things around your socialization, your culture, your education that inform where you relate to yourself, how you take care of yourself, and what services you can access. And also it comes with health issues, because there's drop in estrogen. You are susceptible to those, as they have said, the fractures. As I mentioned, because of the so many estrogen receptors around the world, around your body, the body feels frustrated. It becomes weakened, and so you find that you're becoming sicker and, like, in quotes, more sick, and you don't know how to do with that. When you come again, because of the sickness, you need more medical attention. What does that mean? Using more money. So economically, you need to be, because you will need that. Remember, globally, I have not seen a government that has given hormonal replacement therapy for free for women. Yeah. So you need to have that for you to be comfortable, or for you to maneuver through menopause correctly. And then when you also look at the same community, still, as much as they're condemning you to be old, still expect a certain, giving back to them. Because you're old, you're now responsible, you have seen it all. They will come for you for advice, and they are blind to the struggles that you're having as a human being. So there is that community burden being still placed on you, and you're expected to deliver, because as a woman, you don't deliver, we will still judge you and we will condemn you. And the other area that we are seeing also the problem, there's a change in pattern of abuse, elderly, or the women who are beyond their reproductive ages. They are physically weak, and there's a funny mindset of people who are just thinking that, yes, I will sexually abuse an old person because they don't have the strength to fight back, or it's just a fantasy they want to fulfill. and we are seeing there is a rise in abuse of women who are beyond their reproductive age, and it's a concern. And because of the weakened stem in their reproductive, the protective system in their reproductive organs, we find they are also more susceptible to STIs. And now, because of their age, they cannot publicly say that, I'm sexually active and I have acquired an STI. So that the shaming and the recurrent STIs make it worse for them. And remember, at this age, yes, it's also the other times when we are seeing long-term illnesses coming up, even some cancers becoming more prominent at this. And it is expected that you accept that. But again, if you are not well prepared and the healthcare system is also not well prepared, you suffer more. But again, just to go back and say that these problems are more pronounced in third world countries compared to first world countries, because they are prepared and their people are informed and they have access to this. And the second one, the policies, programs implemented by governments, we are seeing now the governments are trying to support researchers. I'm being very intentional with trying, because I'm not feeling the commitment from governments. They are trying because it is now the government is seeing the impact of this on the economy. We are having more people who are sick. We are having more people who are not coming to work. We are having more people who are having long-term illnesses of something. If they intervened, it will lower. So now the government are trying to see how then can we improve this so that we don't spend more on the healthcare of these people, so that we don't lose more on these people not being able to work and not being able to support their family. And also the other policies that are now out and being campaigned is the workplace policies. We are now aware that most companies, especially in the private companies, there's a lot of campaign on menopausal leave. Yeah. So menopausal leave or menopausal allowance it's trying to be lenient to women of premenopause and menopausal age, so that if it's too overwhelming, you are allowed to take leave, or you are allowed to work short hours, or you are given lighter duties, because the system understands that it's not your fault and that leave is official. And then the other thing is also there's a lot of now public awareness, education program. People are being educated, there is information. However, it is not adequate. It is not in all languages, because if you go into the internet now, yes, everything is available. If you look at the apps, most apps are in English. How many people at that age can read English? That is also a challenge, but at least the information is there, although more needs to be done. And the government is now allowing those information researches to be disseminated, and then access to care, whether it is online or physical, it is improving. Yeah, it is improving. Honestly, I'm happy that in Sri Lanka, at least there is a department that is talking about menopause. How many countries have that department? Very few. Because in other countries, what do they call it? Those are geriatrics. It's not. It's something that can be fixed. It's something with more education we can, fix it. I am happy Sri Lanka has that. More countries, they say we have access to care only if the woman is able to know that this is what my problem is and can I have. But again, access to care that is not free, that is payable. How many women have that muscle capacity to pay? I've been in the humanitarian for so long. Any hormonal treatment is considered luxury in humanitarian situations. So you can imagine. Thank you.
Thank you for all those points to ponder on SRT, menopause leave. And yes, we have a word for menopause in Sri Lanka. We don't, right? We have a Sinhala word for it. Okay, moving on to the final round of questions. This is to Dr. Darshana Begunawardena. What policies and programs should be incorporated into a country's health system to address menopause-related issues more effectively?
Answering this question, I think I was discussing about the issues in the first, and we should find out these issues, and then we should find the options how to mitigate and all these issues. The awareness is the main problem, so we all realize that, and I think awareness, as I mentioned, so we should have a program to make everybody aware of this, and we should have some short-term and the long-term plans. Short-term plans is we should educate our service providers, especially at the set of ground levels and at the primary healthcare centers, and we can educate them how to perceive the menopause and how to receive the lady with menopause and how we are going to advise, and then do the other strategies, curative strategies. And the other thing is, in the long run, I think we need to include this menopause module into undergraduates, postgraduates, and then midwife and the nurses at their levels, different levels. So we need to address about these problems, and so we can include these modules. And the other one, we can educate our teachers, school teachers, then we can make a teachers training module. So we should have a sort of a policy. The awareness campaign or programs will not achieve all these. We need a big backup from the ministry and the ministerial level. So if we can have a sort of a women's health strategy, the plan or a strategy for menopause as a policy, drafted by the government. So then we can, according to this policy, we can do something. Then we have a sort of a backup from the ministerial level. That's very necessary in a country like us. And the other thing is, I think it is probably good if we can have a separate directorate, because adult directorate will not address issues in menopause. And if we can have a separate directorate, I think that would be very helpful for us to manage menopause related problems. And the other thing is, now we have very less number of studies and research on this topic, so we should promote. Actually, so our founder president wants to the promote this research activities on this, and I can mention even I think he gave the 200,000 rupees to the society. That is only to support anybody who is doing research on this topic. I think that's a very good initiative. I think he has found the need for the day. And so then we should promote research and studies. And the other thing is, we should have a dedicated clinic in the sense of, if we can, the government can support this midlife clinic. So then to initiate and the maintenance is really important. So that would be very helpful for us to address this crowd and the population, and then they can come and receive this. They can discuss these things with us. And then the access, and everybody should have the access to healthcare facilities. I think it's not only in Colombo, not in town areas, even in rural areas, the same access, free access should be available. And the other thing is social stigma. So we can change. We are going to discuss this very freely in forums and the open discussions, and then we can make it something like a very free thing in their life and the normal thing in their life. And so then everybody is very free to discuss any problems. And the other thing is the support groups. And I think this is very helpful. We have realized, even being a medical professional, so if I say something to a female, even to you, say like, you can think, anyway, he's a male, how come he knows about this menopause? If I can get a help from another colleague, say that who is passing through this life, and then they will realize, okay, kind of very good sort of, that's provocational, that sort of attitude. And I think this support group has to be created. And the other thing is, all in all, we should provide them with menopause hormone therapy. At least if government can't give it free of charge, at least at a low cost. And so that also will be very helpful, because there's an economic crisis still going on in Sri Lanka. These are some of the initiatives I think which I plan, and then we as a menopause society. And the other thing is, we should use the media. I think we are doing that. So media now, they are the giant behind all these. They can make black into white into black. So then, especially at the hand of these uneducated people, they play, like nothing, no? So we use this media in a professional way, in a good way, to, get this crowd and then to educate them. And I think this is the need in the country now. And I think these are the things I propose to uplift the life of midlife women. I think if we do this, the ministry has to invest. Even we know this is our goal, SDG goal, I think 16 or 15, I can't remember. It says everybody should get the equal right for medical, the access. And if government is going to invest in this, I think it's not a waste. I think it's an investment, because we can reduce this lot of health implications in this crowd, and then we can get them into the productive life. and so then will be the development of the country. And so we can fight, we can make a resilient, the sort of environment to fight these health issues, and we can make a good future, because these women again our future, I would say, because according to the population projections, there will be like more than 30% in this age, post reproductive age. Now it is only 25%. In 5 years, 10 years times, it will be more than the 35%. Thank you.
Okay, Dakshana, you are very right with the changing demographics. Yes, we will be having a huge proportion of females with these issues, and yes, the empower SDGs, UHC, leaving no one behind and next to everyone. Yes, very important points. So moving on to Dr. Disanayak again, how are we going to educate the society and family to embrace menopause in a positive manner?
Actually, the menopause is a blessing, according to my opinion, because normal the menopause will start around, so she'll be 1/3 of her life is on this stage, and at that time she's already menopaused and she's not bleeding, and so she does, so she can wear anything, whatever the thing she can wear, because earlier she have to think what's going, when she going somewhere she have to get some and there's no contraception to be used now, so she can enjoy her life very much rather than the earlier, and again she's now mature, so she can take good decisions, not like earlier. So, and she have, she can go anywhere, she's have more freedom, and most of the time the family is completed and children are big, and so she don't have to spend much with the family, so she have more freedom, so she can spend time with herself. So, and she has some money also. When you compare with young age group, she had earned something, and otherwise she know how to earn. So she have some money. So she enjoy menopause life in a good way if she cope up with these symptoms and signs of the menopause. So to have a good life in last decade of her life, so we have to, she have to do lot of things, as well as her family members have help her to enjoy herself, and the society also. For that, I think the family members also have to know these symptoms, as I told earlier, and aware about these symptoms. Then the family members can help her to overcome these problems. For that, I think the best person is public health midwife, because we have a good network in the grassroots level. She is going home to home and discuss with every people, all the people in this house about the child care and the maternal care. So why can't she discuss with the person who is there, the grandmother? Also she can discuss. Normally she meet those people also. So she can drop on each house where this age group is available, and she can discuss these issues with herself and with the family members also, and she can address on that level and settle the problems. So that is the best thing I think we can do in grassroots, because already we have that network. Only thing is, then the population is very high, getting high for that midwife. Then we have to think about that, how you are going to minimize the workload of the PHM, because she can do the 24 hours, so minimize and give some incentive or some promotion and things. They can do a lot of things. So that is the best thing. On the other hand, for the society level, most of things are, I think, overlapping. Darshan has told already. The one thing is educating the school children. He told about the teachers. I want to tell about sensitization of the children also. We need, that's a big theme, because all children are in the family members. So if you are sensitizing them in school level, then the message is going with them to the house, and they know how to care their mother and the grandmother. So they help them. So we have to sensitize them, and also we have to get them to the school curriculum as well as the exam also, because these days, if you are not the question to the exam, they never think about it. So I think you have to put in the exam also, as well as the school curriculum. So the children all are getting the menopause issues to the mind, and they will help the family member. The other thing is one that we can do a lot of things. Do some awareness program in the work environment sector. So at the moment also Menopause Society is doing that. There are some leading companies are with us, join with us and getting that knowledge from us, and so we have to sensitize the workforce as well as the administrative level. Then you can have a good environment for the workplace. If some workers have some problems, they can discuss with them. And sometimes there are workers who are suffering with these issues, and because of that they are getting, their work is less and they are getting blamed, but they don't come out with these issues because of these our cultural issues and things. They don't want to expose themselves. So if the administrative level are sensitized on that, these people will come out with their problems. And there are most of these workplaces, there are health center. So these health centers, we can make it menopause friendly health centers. So then they can come there and they can discuss with those issues with the person who they are, the nurse or the PHI or someone who the person is there. That's another thing that we can do when you continuously get in leave, or then we can analyze these things, why she is get this leave, and don't think about it in an individual base. This fellow is getting so many leave, but see how these things happen in them, because the teamwork is getting less and the outcome also getting very badly affected with that. So we have to think those things, and in the workplaces we have to analyze all these things and correct there itself. I think the workforce will come, the work outcome will come better. That's one thing. Again, what I thought is the media. The media already, Darshana told, that's the best thing these days, because you can reach the next end. Because so they are that all. But the problem is in the media, the air time and things very difficult to get it. But if the government is helping, they give some promotional things, and if support, sometimes the national media levels you can get some support, and it can be the media also can be just a small narration or to a video, or sometimes you can make a teledrama based on this type of a story, even a film. So these things are good. You can spend the money on that way, and we are giving a message, because there are so many stories behind in our society. We can sensitize those things. So that's the one thing. And the other thing is social media. I want to emphasize social media platform also very good place to get the support and the sensitize the society. So it helps to answer the questions for the people, the person who is suffering these things, as well as the society also. And one more thing I want to tell is the small group. It's a very good thing if you can make it. Preparing small group in the village level. It can based on the public health midwife level with the support of the GN, Grama Niladhari, and the division secretarial office. Also there's a person who is the social worker is there, so you can get the support of them also and make a small menopausal club like thing. For example, you can put a nice name like Mihiri Madivya Club or something. So we can make it something like, so with there you can make some recreational things, they share their knowledge and the issues and exercises, all these things.
Thank you, Dr. Disanaika, for that very extensive explanation on type and settings can use health education. And moving on to our last speaker, Ms. Mukoya, to speak on what are the key age-related issues on a global scale and how have governments responded to these issues.
Okay, thank you. I see time is not on my side, so I will just do a summary on it. Age-related issues, of course, we have demographic shift. There is a projection that in 2050, we will have a doubled number of of persons under the age of 6. You can imagine what that will do to the systems, all the sectors. Yeah. So that means that we are going to have the older population will be bigger than the younger population. And then the health challenges, of course, age health challenges are there, and they are at the increase. And here we are not just talking about acute infection. We are looking at chronic illnesses. And then, of course, the economic impact. The more the sicker, in quotes, the sicker generation you have, the more draining it has to the economy, both at the health sector and even in terms of generating income back to the economy. And then also there are other things like social issues. Yeah, we know ageism is a thing. We when you are young, you are the model. As you grow older, you need to stay home. You need, there are things, there's judgment you get by just having an advanced age. They forget that you have the wisdom. And then there is the caregiving burden, because the elder needs support. It's both at home and also into the government institution. At home, the older people they are more sick, they are more independent on people to carry out their daily activities and all that. They might not be able to do simple things on their own. They might not need assist, either machines or people to help them do that, or they might need to be under care institution. So that also means that the government has to chip in, or the family or the community has to chip in. So that those are just some of them. And then what is the government doing? So one thing is, yes, the government has acted. That is the reality. But now we would really wish that the government commit. The UN has taken lead by developing a guideline that is called the UN Decade of Healthy Aging, 2020 to 2030. Government affirmed that. But when you go on the grassroots, is the government really doing what it is? It's just a roadmap advising governments on the simple steps that they can do to ensure that their aging population is healthy, productive, and still independent, so that they lower those things that we have. And then the other one, of course, now the government, there's the issue of the economic and pension reforms. Most governments all over the world, you can see they are touching on the pension, either increasing it or forcing everyone to be on the pension, because they want to reduce the burden on themselves. So that is a way. It's, the people who have done economics are seeing it. So you find every government is saying, everyone who is employed, maybe before they would say, if you are employed and you earn below $200, that's fine, you don't have to pay. Now they are saying, even if you have earned $50, you must pay. Or they have reviewed the percentage, because they are realizing that when they start giving you the pension, more people are going to the pension, they may need more, and they may not have the money to support that. And also there's a lot of social inclusion and age-friendly environment. We are now starting to talk about aging and accepting that getting old is, everyone will get old, and as she has rightly said, it is a blessing. So we are now socializing aging and not condemning, and the government is doing a lot of that. And I remember doctors talked about educating the community and telling them about these aging processes. That means we are helping or supporting the community to accept this and also be of help. One of the things that we are also trying to do, researchers are there, and they are trying to come up with packages on SRH in a life cycle, so that from as you said, from a young stage, a young girl, a young man should know and anticipate aging is coming. And when I get there, I should be in the best state. And to be in the best state, this is what I need to do. This is what I expect. This is what I should be. This is the best shape I should be in. And then, of course, public awareness, they have said that very well. Education, media is there. One thing that has come to solve, I don't know whether to solve it or to spoil it, AI. Artificial intelligence has come to make it easy for us. But how do we use it? How do we integrate solutions, age-related issues, into AI so that it is available and workable? The other people we should also not forget, sorry to say, but there are also those people who have surgical menopause. It would be right that we force the health system, or we task the health system to support these people, because they got into menopause early and they are abandoned maybe 2 months after, and they struggle with this. So that is one area we should never forget. Some countries in the European have even remembered that there is men andropause, and they have police support. Yes, women in the menopause and the men who their testosterone is decreasing, because them is gradual, but they still get those effects. So those are things that we can borrow and see that to make life easy for aging population. Thank you very much.
Very interesting. Menopause and andropause. Yes, and also about productivity and then getting the maximum use of age-related causes as well. Okay, so since we have run out of time, we can accommodate only one question from the audience. So do we commence?
We spoke about preparing the women to maneuver through menopause, right? So, are there proactive measures a woman implement to be prepared, face menopause?
Over to you. Anyone?
I'll tell you, there are two secrets behind, and one is the balanced diet, one is the exercises. Those are the two main you can any woman can apply into her life. And because you don't know because these two can help in many various ways. And so you have to avoid sugar, and then less carbohydrate, and then it's a balanced diet, and then the exercises, moderate exercises, at least 45 minutes, 1 hour per day, and into 4 days a week. That's basically can help you a lot. Yeah. And then there are some cultural differences and social differences play some roles, but I think before all these too.
Yes, on adding to that, of course, education is very important. People being empowered with information of how their body is changing and why the body is changing and how do they adapt to the changes. He has given you a very good example. Nutrition is number one. Exercise, they said the stronger muscle you have, the easier it is for you to transition through. Having a strong muscle means you okay, and economical stability makes it easier because you are able to buy the hormonal replacement therapy and access information and of course all that, and having a workable health system. Thank you.
And one thing I will add, that stress relief also will be good. You can do some music, listen to music or do some dance. Those things also will be help. The two major things are what the Darshana told, but the awareness and these small things also will help.
So, exercise, healthy diet, stress relieving, and education, and these are non-modifiable, the modifiable risk factors for any of these. Okay, so that brings us to the end of this session, and thank you all. I would like to thank all our speakers for this very important discussion that place here on a very important topic. So, over to you, Damayanti, to wrap up the session. Thank you.
Sir, ladies and gentlemen, as we come to close our mini symposium, it is my privilege to extend a heartful vote of thanks to everyone who contributed to today's event. First and foremost, I would like to express my gratitude to our resource panel, Sir Anuji Gamage, Dr. Darshana Abegunawardana, Dr. Shiromali Disanayak, and Ms. Edna Mukhaya for sharing their valuable insights and expertise. Finally, I would like to thank all of you, our attendees, for your active participation and enthusiasm. Thank you once again for joining us today. I look forward to seeing you at our future gatherings. Thank you.